Module 11 is part 2 of the drugs used to treat cardiovascular disease, including hypertension, heart failure, and arrhythmias. In this module, we will take a deeper dive into cardiovascular drugs, and it will make great connections to your pathophysiology course. You will be familiar with some of the drugs we will be covering in this module, such as alpha and beta blockers, which were discussed in Module 7. According to the CDC, over 600,000 people in the United States die of heart disease every year, which makes it the leading cause of death in our nation. Of those with cardiovascular disease, almost 6 million adults have heart failure, with half of them dying within 5 years of diagnosis. Based on these statistics, as a nurse, you will inevitably be caring for patients that have cardiovascular disease. That is why it is so important for you to know what these medications do and what the body does, so you can see how the medications work, their side effects, so you really understand how to treat cardiovascular disease. To learn how drugs can reduce blood pressure and the side effects they produce, you need to first understand the processes of how the body controls blood pressure and the elements that determine cardiac output. It is also important to understand the action of the renin-angiotensin-aldosterone system, or RAS, and understand those concepts such as stroke volume, peripheral resistance, and baroreceptors. Drugs work to alter these processes and help the cardiovascular system to respond in positive ways. For example, one of the drugs that we will be discussing are the angiotensin-converting enzymes inhibitors, or the ACE inhibitors. And think about what these medications do. Angio means vessel or blood vessel, and tensin means tense. So inhibitors are going to inhibit the tense blood vessel. So they open up the blood vessel. Thereby, they decrease the resistance to blood flow, which decreases blood pressure. Additionally, through the action of these ACE inhibitors, fluid loss occurs because the aldosterone secretion is decreased, thereby causing blood pressure to decrease even further. So cardiovascular drugs will make sense once you grasp the concepts such as cardiac output and what drives blood pressure.